See, good morning, everyone. Thank you for joining us. We'll give it a couple minutes for everyone to hop on in. Thank you for joining. My name is Panayota, she, her pronouns, from Turning Point of Lehigh Valley. I'm the training and education advocate here with the training and education team, just making sure that people are aware of what we do here at Turning Point, and talking a little bit further about some of the nuances that occur with domestic and intimate partner abuse. So before we begin, as we kind of are waiting for people to file in, I'm just going to drop a quick question in the chat. So if you don't mind just telling us where you are from, and if you have any other thoughts or anything you'd like to share. So you want to take a second and type in the chat where you're joining us from. Again, we're grateful to have you. As we, again, are waiting for people to file in, just a reminder that if you are ever interested in seeing more of our events, please feel free to check out our website at turningpointlv.org. We have our events calendar. Additionally, we also will ask for, out of the confidentiality and for the safety of others, if you are asking a question either in the chat or in the question and answer box, if we ask you to not share any specific information, especially information that might not be yours. But if you have any questions or discussion topics, please feel free to type again in the chat or in the Q&A box, and we will get to those as we can. As we go through, there might be difficult subjects that come up. If you need a break, feel free to take a break. This webinar will be offered on demand afterward, so you can always come back to it if you'd like. We will have a survey that should appear in your screen upon exit of the conversation. And last but not least, there will be an email that comes out afterward with information on how to get a certificate of attendance for being here with us. So that being said, thank you for those of you who are joining us and who shared in the chat. Yeah, I guess let's get started. So do you want to take a minute and introduce yourselves really quick and tell us a little bit about what you do? Whoever would like.
Sure, I'll go ahead. I think Keema and I both took ourselves off mute at the exact same time.
Yes, okay, go ahead, Erin. I took myself off to say, Erin, go ahead.
All right, well, thank you. Hi, everyone. I'm Erin Connelly. I'm the Vice President of Impact at United Way of the Greater Lehigh Valley. And in my role here, I work with the wonderful team here to do a lot of different things, including our grant making, our grant seeking, and in particular, a lot of our internal operations. But also one of my favorite parts of my role is working on housing. There's a lot of housing and housing related initiatives that we are really grateful to either lead or be a part of. And so that's part of the reason why I'm here today. Nice to see you all.
Thank you. Thanks, Erin. Keema, I guess it's you.
I know, right? I'm Keema. I am the Transitional Housing Director here at Turning Point of Lehigh Valley. I oversee the housing team, and I am just excited to be here.
Thank you. Yeah. So we're coming at this from a couple different perspectives, right? We're talking about the impact of housing, specifically here in the Lehigh Valley, because that's who we serve, right? But again, not just housing for, the general populace, but the survivors that we work with, domestic and intimate partner abuse survivors. So I guess my first question is, what does a typical day look like for you regarding housing advocacy in your work?
I guess I'll start since I'm
unmuted. A loaded question. Yeah.
Right. So a typical day for me is, going through lots of emails, phone calls, following up with landlords, staying in constant communication with our clients, to make sure that their housing needs are being met, advocating for them if need be. Especially for those who are, like, say, for instance, if we have some who are in housing, they are now settled into their new place. Sometimes we may have to advocate, for them regarding what may be going on in their apartment. Also being a support system for other staff, the other housing advocates here as well. Supportive listening, providing lots and lots of supportive listening for our clients. You know, they go through a lot, they deal with a lot, and sometimes it's just, you know, allowing them to vent. There's so much, my God. Like, there's really a lot. Like, so I don't know if you have like a follow-up question with that, but there's so much in a day. There's meetings, there's you know, bouncing ideas off of other staff, seeing how we can further assist clients. You know, sometimes we may get stuck in an area. So I may go to another staff member or a coworker and say, hey, you know, what about this? You know, we bounce ideas. We have our meetings monthly just to make sure that we're following up, keeping up with rent, making sure that we're getting their rent paid on time, helping them meet goals, whether it be with work or with home, budgeting. So there's a lot in a day that we do. I'm just gonna leave it
Sounds
there.
like it.
It's a lot.
Yeah.
Yeah, thanks, Keema. In my role, housing is really a through line for all we do. And so at the United Way of the Greater Lehigh Valley, we really have three focus areas, or our three bold goals. They're focused on education, healthy aging, and then also what we call community stability. And so our housing work often kind of formally falls in that category of community stability, meaning, you know, we want people to be financially stable, thriving, improved mental health, access to healthy food, etc. So what are all the pieces that go into a really stable and thriving community? But, you know, again, if you think about education, housing is and family stability is such a key factor in ensuring that students can show up every day ready to learn with their bellies full. For healthy aging, you know, I'll share some data later on this morning, but we know that older adults are facing housing insecurity in numbers that we haven't seen for a really long time. And so, you know, when we say that we want to see a community where everyone belongs and everyone thrives, housing is such a core piece of that. So in terms of my day-to-day, it looks different every day, but our role as a convener, as a funder, as a community change agent, along with so many of our partners, including Turning Point, housing is just such a crucial part of that.
Yeah, it's such a multifaceted issue as we talk about it. And even like in preparing for this, you know, I was thinking about there's so many different ways that this could go. In talking really about the intersection specifically between, you know, housing and survivors, I just wanted to share the statistic that I found. So from the National Domestic Violence Hotline, they did share that approximately 57% of homeless women report domestic abuse as their immediate cause of homelessness. However, also approximately 85% of domestic abuse survivors had unmet housing needs. So emergency shelters are typically both the top need and most urgent need of those who contact the helpline. The lack of access to safe and affordable housing often leads survivors to stay in or return to abusive relationships. So one of the things that you mentioned, Erin, is a really good point, right? The concept of stability, right? Making sure that, and that again, there's so many factors to that. So I guess my first question to kind of kick it off is, you know, what are some of the barriers or risk factors that we often see that may affect, you know, somebody's stability in the world of housing?
Yeah, I mean, there are, you know, in terms of barriers, you know, I think of financial stability as having choice and having agency, and the ability to not make those really difficult decisions on, you know, do I pay for medication or do I pay for groceries this week, right? And in particular, you know, when we're thinking about what are the strains on an individual or family's budget that can lead to instability, housing is right up there. But I think so often we don't always think of childcare. Childcare is a humongous cost. And it's an investment and a cost that it helps facilitate being able to further earn, right? And so when you don't have access or the ability to afford childcare, that also really limits your ability to grow economically.
Mhm.
And I would just add like another barrier that I've seen, one, credit. Credit, previous evictions, right? Some of those evictions would have come from if they've been in an abusive relationship and things were put in their name, but they weren't the ones who were actually the providers in the home. And the abuser decided to stop paying. Now it falls on the survivor. This is one of the biggest, because I've had contact with clients and they find places, and it's so heartbreaking because time and time again, it's like, they find a place, it's a place that they can possibly afford or build up the income to afford it down the line. And this one thing is in the way. So it would either be credit, or the other thing that you see is where the family is a little bit bigger, right? So the family is a little bit bigger, meaning they need more space, meaning the rent is going to be higher. But because of the amount of children that they may have, it causes them not to be able to work or even increase their income because, like Erin said, now you have childcare, right? So they may have Title 20, which covers a part of the day, but what if they need to work a second job? Title 20 is only going to pay for that one part. So now you have where they need the bigger space because they have a bigger family, but now they also can't afford the rent for this bigger space. So it's kind of like a catch-22. So when you see things like that, it can cause them to go back to the abuser. Or if there's a health issue, that's another barrier that we see. Sometimes someone has health issues, and Erin, I believe you mentioned it, like not being able to afford medications. So then it's like, what do? Do you take care of your health, or do you put that on the back burner and try to have a stable home? But then is it really stable if you're unhealthy, right? Because now you can end up losing it when you decide to take care of yourself. So there's like a ton of barriers that we see constantly. But childcare, and just the financial piece of it is a big part of it, because the rent amount now is, oh my God, it's so expensive, right? And it's like what you need to make in order to be able to be stable. A lot of people are not making that. So it's kind of hard.
Yeah, there was
Yeah.
a graphic I saw recently from the Housing Alliance of Pennsylvania that I guess they did a study and said, to afford a modest 2-bedroom apartment in the Lehigh Valley, you would need to make $27.42 an hour.
Right.
And that's for a 2-bedroom. So again, like you said, if there's more children, or, how many of us are making 27.42 or more or less? Kind of that consideration. And the fair market rent, correct me if I'm wrong on this, but what they had was the 2-bedroom apartment is around $13.65.
It's a little bit more than that.
Okay.
But we have seen some 2 bedrooms that is around that, but some places are a little bit higher, and it also depends on the area.
Mhm.
So you have some landlords who are asking for the fair market value or a little higher, but the area is not ideal, right? Especially if you have children. So then that comes into play. So then a lot of our clients feel like they're settling again. They settled in an abusive place, an abusive relationship, and they did what they had to do to survive. And then it's like, now you're out, but now you have to settle yet again in a place that's not ideal, especially if you're raising children. So it's like, so yeah, so it's a lot. 1 bedroom now is about maybe $1,250. A studio is anywhere from $900 to $1,000. And rooms now are renting for anywhere between $600 to $900 for a room.
At fair market.
Yes.
Wow. That's, yeah.
Yes.
So I guess this is a good kind of, there's so many factors to this. I think the financial abuse is absolutely a piece that I want to get to.
Yes.
But as we're kind of talking about cost, I think, what is the real cost of housing, right? For survivors or just for individuals, period. And I know, Erin, you really focus a lot on the ALICE data that we kind of talk about. And I know you're way more of a pro on this than I am, so I'm going to let you kind of talk a little bit about what that is.
Sure. So I can't see the group spaces, but if you all are familiar with the term ALICE, it's an acronym and it stands for Asset Limited, Income Constrained, Employed. And really, this is a data project that seeks to understand what does it actually cost to survive and then actually thrive in different regions, frankly, of the country. So I can share a little data specifically with the Lehigh Valley. I see we have some folks from Lancaster, and New Jersey, and there's ALICE data for both of those areas as well. So it's county by county, and then within the county, you can actually look and see by municipality, by city, and what the data shows is that, at least within the Lehigh Valley, over 41% of households, so that could be individuals, it could be two people, it could be families, are not making enough to make ends meet. So they're living paycheck to paycheck. So what the ALICE data does is really kind of flip on its head, you know, the concept that looking just at the federal poverty level is enough to have an understanding of how we can help our community, our friends, and our neighbors. And I think it really goes a long way to stop othering financial instability. Like, you know, if you went for a walk in your community, so I live in Bethlehem City, over 50% of people who live there are considered ALICE. So that means under this threshold. So that means when I go for a walk, 1 out of 2 people that I see maybe, you know, going through these hard choices every day of how the heck am I going to pay for rent or pay for my mortgage and, you know, pay for childcare. That's a lot. That's a strain on a community. That's a strain on a community's mental health. And I'll just share my screen really quickly here because I know it's kind of more of a
Visual concept.
informal, yeah. But let's see here. Can you all
Is
see
that
that?
Yeah.
The actual screen? Okay, good.
Yep.
All right. So again, this is our United Way's coverage area. So that's Carbon, Lehigh, and Northampton. But just also want to emphasize for all of you not from the greater Lehigh Valley, there's going to be data for you as well. And so this data comes back well, it has been every other year. Now it's going to be every year. You can really see in 2021 the impact of pandemic era assistance. So child tax credits, you know, direct benefits, because then you see in 2022, the numbers of those under the ALICE threshold have gone up again. And I know, you know, many of you see this every day in your work. And so these numbers are probably not a surprise, but it always is striking to see it, you know, in data form. So take, for example, in Lehigh and Northampton County, that's 47% of the community are living paycheck to paycheck. And like I mentioned before, senior households in our area has gone up from 50% to 57% are having trouble making ends meet. So that is a really disturbing, that's a disturbing statistic, right? Because we keep on seeing those numbers increase. Another disturbing statistic is while ALICE increased across all races and ethnicities, within Black households in particular, we saw the greatest increases, so 19%. So that's not 19 percentage points, it's 19% between 2021 to 2022. So when you think about our community as a whole, you know, these numbers are alarming. I also just want to share, you both were talking about how much it costs to, you know, different housing costs. One of the other data points from ALICE is that the survival budget. So this is not going on vacation. This is not saving for retirement. This is like the bare bones. Here's what I need to make it through the day, make sure I have some food on my table, that my children have a place to go during the day. It does not allow for anything extra. In let's say Lehigh and Northampton County, you can see this jump from 2021 to 2022 for a family of 4. So this is 2 adults and a preschooler and an infant. So it's taking into account the highest childcare costs. I guess higher childcare costs would be 2 infants, but in this case, we're looking at 1 infant and 1 preschooler. So in Northampton County, for example, to just make ends meet as a family of 4 with 2 very young children, your household needs to earn over $100,000. We know the median income in Northampton County is closer to 60,000. So I'll stop sharing, but it's really sobering data and puts into context just how much more work we need to do as a community to really ensure that you know, we're doing better, right? If there's so many people that are struggling to make ends meet, we're not doing what we can as a community to make sure that we're all thriving.
I think sobering is a good word choice, right? Like you said, it's really 1 and 2, give or take, that are under this Alice threshold, you know, and that's just generally speaking. Whereas when you consider the amount of financial abuse that may occur, a lot of people might not know this, but in unhealthy relationships, 99% of them have some level of financial abuse. So if you're in an unhealthy relationship, odds are there is some level of financial abuse included in that. And it's honestly often one of the largest types of abuse that occur, but it is so overlooked frequently. So I guess Keema, I don't know if you want to speak a little bit more to, you know, some of the levels of financial abuse that we might see in clients and how that, you know, further affects their ability to gain housing.
Yes, actually, you're right. That number is high for the financial abuse. It's actually increasing even the more. I mean, it is something that is overlooked as far as intimate partner abuse, right? Or if it's just, you know, even amongst family members. But we have seen a lot of that where the survivor is the one who is not able to work, not able to leave, not able to provide for themselves. So the way that this affects the clients is when they are finally able to get away, now it's like, now what? Now what do I do? Right? Some of them have not worked in years. So it's like starting all over again. If you can think back to your very first job, right? And if you don't have that work history, then it makes it even a little, you know, even the more harder to get a job because where's the work history? So when you're trying to apply for jobs, even if you have a degree, but there's no work history, it can still make it, you know, exceptionally hard for you. But then if you are able to get a job, but because of the lack of work history, you're not going to be making as nearly as much as you need to make. And just like what Erin just showed us, what people need to make in order to survive, a lot of people are not making that a lot. So I've seen clients, they come in and they have experienced the financial abuse, and then just trying to get back, and then to balance it all, right? They've never had to balance it all. So all of this is new to them, trying to balance a work life and then also try to balance the children if the children are going to be living with the survivor, and then also trying to manage bills. This is something that they've never had to worry about before. So, and I believe that this is part of why the financial abuse and relationships kind of gets overlooked, because it's like, well, you're not being physically abused. You're safe. You have a roof over your head. Everything is fine. What's the big deal? Well, it is a big deal because then you don't know how to provide or even survive on your own. So it's a little bit harder. So for clients like that, we tend to, you know, be more understanding and just kind of be as supportive as possible to make sure that they can become stable and successful. So,
And
yeah.
I think too, with the work history factor, right? A lot of times we think of financial abuse as being, you know, limiting access to financials or limiting the ability to work. But sometimes that could even be they have the work history, but it may have been sabotaged by the abuser where, you
That
know,
too.
they were visiting their work and affecting their, you know, relationships with their employers or whatnot. So, you know, there's so many different factors that can play into all of this. You mentioned credit earlier too, you know, abusing the credit scores, and yeah, there's so many factors that can go into all of this.
So many. Yeah.
I think the other thing that I wanted to touch on too, just in regards to barriers, would be just kind of societal expectations, right? You sort of touched on this a little bit, sort of this, why don't you just leave, or why don't you just get a job? Or, it's really not as easy as I think people think it is. Even just in those scenarios, really, you're starting fresh. You're, and a lot of times you're starting fresh and kind of going back 10, 15, 20 years, however long you were in this relationship, and
Yeah.
really having to restart in a whole new era, a whole new generation of work, of, technology expectations, of everything, not to mention if there's kids or pets or disabilities or other factors that may further hinder your ability to succeed. So
Yeah,
yeah.
I mean, even with that, we have to look at it as anyone who has been in any DV type of situation, and especially if it's been for years, this survivor has to unlearn everything that they have been in. And that takes work and that takes time. Um, so yeah, like for someone say, why don't you just leave? Well, this is all that they have known for the last 10, 15 years, right? And while they may not have experienced the physical abuse of it, but they have experienced abuse in general, you still have to unlearn all of that. You have learned, see, it comes in like bit by bit, right? Little by little, that you become so used to living a certain kind of way until you finally, it's like, wow, wait, hold up, this is not right. I need to get out of here. But now you have to unlearn everything. And even though the situation was abusive and it was not ideal living situation, it was something that survivors get used to. So that's something that we have to look at. We can't just say, why don't you just leave? That's the easy way.
Mhm.
It
And I
makes
think
sense, but it doesn't. So
a lot of people don't realize too, and this statistic kind of blew my mind when I first heard it, but it is the most dangerous time for a survivor when they choose to leave, because that is often when the abuser recognizes that they're losing control of the situation, and they will often escalate the levels of violence that may occur. And that goes on for the next 2 years. So it's 75% more likely that it will turn violent for the next 2 years, which is insane to me.
it is. And what I would say is what I love about Turning Point, and not to say that we're the end all be all, but I love that we actually do safety planning with our clients and we try to make it as safe as possible. So if we know, like, if a client is living with the abuser still, our number is blocked. They can't, return a phone call, or we set times up, or whatever we can do to make it as safe as possible. Because you're right, when it's time for them to leave, this is the most dangerous time. And we want to make sure that they are safe and safe as possible, even if that means that we can't have a conversation with them, we can't speak with them, whatever's going to keep them safe. So I love that about Turning Point, that we do have safety planning with our clients.
Yeah. So
Yeah.
this kind of is a good transition to some of my next questions, which are sort of, how are we responding? How are we serving this population that is Alice, under the Alice, I don't know how to phrase it, spectrum, or, that are survivors kind of rebuilding in this situation? What is your organization doing to respond? Or what can we as a community be doing to respond and support?
Sure. So a number of different things. I think, one of the key elements when we're thinking about kind of the what are the systems changes, and then what are the kind of more tangible short-term changes. But system-wide, when we're thinking about policies and advocacy efforts, one of the elements is this gap between what income levels for certain amounts or certain supports are lower than reality, right? And so in many cases, folks are told, oh, you make too much to access XYZ. And that sounds absurd to them, because how can I be making too much if I can barely afford to, keep living in my home, right? So advocacy and understanding around, here's what it actually costs to live, here's how inflation is affecting day-to-day lives, is really important for our legislators, for our policymakers, and that concerted effort to talk about, changing the income limits or changing the understanding of how we can better support our community. So that's kind of systems. There's also a lot of policy and advocacy needed around, like we were talking about before, early childhood, education, and what are some elements that we can further reduce the cost burden for some needs for families. So at United Way, we've been working with our state organization on things like state earned income tax credit. So we have the federal state or the federal earned income tax credit. A state one would put more money directly in people's pockets.
Mm.
So that's kind of systems at large. But then in terms of what we're all working on together on a regional level, so the Lehigh Valley RAB, so the Regional Homeless Advisory Board, has been working together over the past few years, and this includes Turning Point and United Way and 3rd Street and New Bethany and a whole bunch of folks on a Lehigh Valley landlord collective. And the goal there is really, how can we increase the units, safe and affordable units that are available to families and individuals with barriers, including DV. And so we incentivize, we have jointly applied for grants that has a pot of money that can incentivize landlords to be part of this network and give nonprofits like Turning Point kind of first right of refusal. We have these units available for folks that you work with. And it's a way of kind of, as a collective, working together to ensure that we have more housing available. So landlords can also get a higher amount of funds, increased incentive if a family or an individual has many barriers. So we are talking about all the barriers that can come into play. So that incentive can go up and down depending on that too. So that's one example of something I'm really proud to be part of, because it is such a collective effort to say, here's what we can do today, now, to ease the pressure on housing, even if just a little bit.
There's essentially that financial incentive and or just incentive in general, whatever makes sense with the landlords and the community to, increase housing and stuff. That's awesome. Yeah.
And I would say for us, for Turning Point, the way that we're responding, just by the services that we provide, right? So we have a array of different type of services with counseling, crisis services. We have our 24-hour hotline, just making sure that we're there for our clients. With the housing, the transitional housing program, we have child and teen services. We have legal advocacy, right, to be there with our clients if they need that support in the courtroom, which is very important, especially if they're trying to file for a PFA, and that can be really scary, right? Standing next to the abuser, and you're trying to fend for yourself and trying to protect yourself as much as possible. And just advocating for our clients as much as possible, just meeting them where they are, and trying not to limit, how can I say this? Like, I don't want to say, because there's a limit, but trying not to limit like how we can help. But if whatever we can't do, but also having other resources to provide to survivors. If it's not through us, then, we have connections with different organizations, as Erin stated before. So if it's something that we can't do, then we more than likely have another resource that we can provide to our survivors. So just meeting them where they are, just being that open door for them.
Keema, do you want to talk a little bit about our two main, housing focused services, Safe House versus transitional housing, and kind of the difference between?
So yeah, our Safe House is which is our shelter. Our Safe House is for those who are in immediate danger. They need to leave a situation immediately. They're fleeing DV. That's mainly our Safe House, is to provide a safe environment for them, right? That they are safe, they are as comfortable as possible, even though it may not be the most comfortable place, but to provide that safety for them in that time that they need it. I know Lori and I spoke a little bit about it. I'm not all like the ins and outs of Safe House because I'm not in the Safe House. But Lori and I spoke about that. And as far as the transitional housing, we are more of getting them into their safe space, right? Their own space, that stable housing. That's more of our focus. So we still want them to be safe. The goal across the board, right, is for them to be safe. But then once they come from safe house into the transitional housing, we want to make sure that not only are they safe, but now they're also stable and successful, and just being able to build a place of their own. Lori, I don't know if you want to add anything. I told her I was going to pull on her. I see her there.
And I said I promised I'd stay quiet unless
I
called
know,
out.
but I'm pulling on her.
Oh, thanks. No, I think you said it well. Again, we've had the safe house traditionally forever. That's how a lot of domestic violence services started, just helping someone get to someone's living room. It's grown into these programs. So yeah, but we know it has its limits. If you have other supports, you're likely not going to want to go into a safe house program. Temporarily, when you're feeling really afraid, I think it could be a great place. You feel hugged and embraced with 24-hour counseling services. We have a lot of other supportive services. We provide food, your necessities. So if you literally are running out of your house with the clothes on your back, we'll work with you to get replacement items, everything from clothing to a warm meal to your birth certificates, your other documents you might need. I think especially if you have kiddos, living in a shared environment, being there long term can start to feel a little restrictive as you start to ease away from the immediate safety needs, which is what happens for a lot of people, not everybody. For some people, we have to help them relocate someplace else out of the area. We can certainly work with things like the state OVA's address confidentiality program. I mean, there's a lot of things we can connect people with. But for some people, if they really have few resources, they have not much of a job history. They've never rented or had a ton of evictions and bad debts put in their name, which is a really effective way to keep you from moving on your own. Getting into a longer term place is really hard to do. And so I think that is the big difference. For some people, we try and model the rapid rehousing. It's a way to avoid having to come to shelter altogether if that's a possibility in your situation. For other people, it may be the only option they have to work with our advocates to go look at apartments, look at their credit reports, do all the footwork you need to do to actually go get a place. And hopefully after, ideally, from 6 to 12 months, but for some people, maybe up to closer to 18 months, at most the 24 months, if you absolutely need it, to kind of get yourself situated. And then at the end of that time, whether it's 3 months or 6 months or 18, you're financially able to support this place that you're at. It's an apartment in your own name. Your kids, you have developed a support system, a routine. It's your own, right? So there's nothing you have to move out from at that time period. And hopefully you've also taken advantage of a lot of the other supports. We try to really walk the walk in low barrier, really client-centered empowerment, which is we, really try to aspire that if our services have value, you'll participate, but we're not going to make doing counseling or any of those things a condition of getting help through us.
Right.
So I think, in our mind, they're definitely related, but they are very separate programs, and being in one doesn't necessarily mean you had to be part of the other.
Right.
So Laura, you bring up an interesting topic, which is something we kind of talked about when we were meeting about this, but I wanted to make sure that, we're sharing this as well. Sort of this topic of being trauma informed, specifically in the shelter environment, and how, even somebody joining us in this sort of environment can still be going through a variety of barriers of just, I don't think, and correct me if I'm wrong on this, but I don't think a lot of people realize that when somebody's staying with us in our shelter, they're still technically considered homeless. From a, paper perspective. And there's a lot of, additional factors as far as just being trauma informed in a shelter or communal environment that, come up often. So I don't know if anyone wants to speak on that. I don't know if I just kind of covered it all.
It
Keema,
sounds
do you
like
want to speak a little bit about the work your team does, and especially around the assessments? Because again, we
Sure.
know that one of the challenges is interfacing with these systems. If you've never had to be part of the social service system, it can be really humbling and sometimes shocking. And we talk about SPDATs and all those things that come up that you're used to. But again, what you and your team do to kind of help make that at least a little, again, more trauma informed, feel a little less, of a barrier for people.
Yeah, so Paniota, you actually covered a lot of it, but from the assessment aspect of it, we do the 2-on-1 assessment. And I want to say it in a way, I don't want to make it seem like the assessment is not, it's not as trauma informed as we are. Let me, if I can say that. If I can say that. So we will do the 2-on-1 assessment because we want to make sure that the questions that are being asked are capturing the full, or at least enough of the client's information, so that when we put the assessment into the system, they have a better chance of receiving services or the help that they may need, or a funding source. They may need the rental assistance. It may be, the rental assistance. I'll just leave it at that. So that's normally what we do here in the housing department. So we'll do a 2-on-1. We'll ask the questions with our clients. We'll get as much information as possible. We'll meet with the CE regional manager, have those assessments put in. And normally what happens is, there is a scoring process. Depending on the score, it sets the priority level, right, of when they can be pulled. Now, there have been times, because we have actually met with clients and the assessment may come up one way, but we have actually had conversations and we've met with clients and we understand that this assessment is not catching the full thing. We can kind of then advocate for them. Like, hey, this person really needs the help. I know that the system doesn't show it this way, but we've sat with this person, we talked to this person, we understand the situation, and we would really like to advocate for them to see if we can get the help that they need. So I think that's the really beautiful part about our housing team, is being able to advocate for those, one, who can't advocate for themselves, and two, advocating for those where the assessment does not capture what they're actually going through. So for instance, Paniota, you spoke about how being in the shelter, right? It is considered homeless. So on the assessment, they would consider that person homeless. But what about someone who's been abused for 20 years, but they've lived in the house for 20 years? And they experienced abuse for 20 years. On that assessment, it doesn't look like they've been homeless. So now we have to advocate in a way that shows, yes, even though they may have had a roof over their head, technically they have not been stably housed for 20 years. So we have to kind of like, make that, what's the word I'm looking for? Like, we have to advocate for them in that way so that they understand, listen, I know it may seem like they've always been housed, right? It seems like their life is good on paper. It doesn't look like priority wise that they would be up there with somebody who's been chronically homeless, but technically they have not been stably housed for 20 years. And now they're just now trying to find a way out. So I think that's the beautiful part about us in the housing department, to be able to sit and speak with our clients and get the story. Because otherwise, honestly, there are times where they may call the 211 and they may not disclose certain information. One, because it feels, it's not as personal, right? And it's kind of like you're just doing this thing over the phone, as opposed to having someone face to face where you can actually conversate with, just have a conversation and talk things out and hear them out, to where it's not like say yes or no, on a scale of 1 to 10, any of that, but actually having someone ask a question and then letting them explain their situation, which gives us a better way to fight for them or advocate for them, shall I say. So.
Yeah. And just to backtrack a little bit for anyone joining that really isn't in the social services field. So 211, the way I always explain it is like 911 is for emergencies, 211 is for resources. So 211 is like the number that you can call if you're ever seeking resources. And through that, there's this housing assessment, which is what we also do to kind of assess the needs of and advocate for those who are going through a lot of those barriers and safety, stability concerns, right? So I guess, as we're kind of talking about this and kind of combining efforts on a larger scale of things, so we talk about policy and advocating, how can we, thank you, Lori. Lori is our executive director, by the way, for those that maybe are not familiar. But so I guess my question is, how can we change our efforts both as individuals and as a community to be more impactful in those we're serving?
I would just say being more trauma informed, showing a little bit more compassion, having a better understanding of what abuse looks like across the board, and not just putting it into one category. That's what I would say, just being a little bit more trauma informed and have a better understanding.
Yeah, and I have so much admiration and respect for the Turning Point team and the way y'all have been able to really walk the walk with trauma-informed approaches and care. At United Way, we have a coalition called Resilient LV that is really about raising awareness of trauma-informed approaches. And so thinking about a number of the trainings that my colleagues do in, say, in the education sector or in the senior services sector, you never really know what people are going through or have gone through. And so thinking about perhaps maybe a family that your team has interacted with, maybe a couple of years down the road, they're in one of our school systems, and what happens if the teachers or the educators aren't trauma informed, right? And so there's such a value to having that trauma-informed approach in every sector, every social services, every human services sector, education, criminal justice, the whole, just everything, because you truly don't know what people are bringing with them when you interact with them. So just kudos to you and your team for all you do in that area.
Thank you. You guys
Thank
as
you.
well. You do a lot
Yeah.
too. I always think of, like, we always talk about, not always, but the concept of the golden rule is kind of thrown out often, treat others as you would want them to treat you. And I think being trauma informed is kind of the opposite, treating others as they want to be treated, and making sure that you're having that conversation of, like, what do you need? How can I support you? And giving them that empowerment and that support and respect to make their own decisions. I think especially in a survivor concept too, if abuse centers around this concept of power and control, and your power and control being taken from you, giving that power back to somebody to make those decisions and respecting those decisions is super important. So I think that also kind of ties into that being trauma informed and respecting those decisions. Is there anything us as listeners can do to best support your mission or your work that maybe we didn't cover already?
I don't know. I have no idea, honestly. I don't know.
I mean, I'm going to throw a little pitch for our own team right here, but
Go ahead.
being more informed and providing
Yes.
more education or receiving more education and awareness, I think, is a huge piece of it. Because we can't fix what we don't know. And, I think abuse tends to thrive in the shadows. And if we don't talk about it, then it continues to thrive. So the more we talk about it and educate and learn dynamics and the importance of it, then hopefully the more we can help our survivors. So
I'm going to double down on your pitch real quick before Erin goes and just say, I mean, to that end, and again, not knowing the affiliation of people here, but I think Paniota has done fabulous things of helping to bring these types of things, of opportunities out there. I know she is also working with our training director to, and we have some information on our website. We'll be updating it more, but they've really created some dynamic training sessions specifically for workplaces. So both geared towards nonprofits, both smaller social services, big ones, as well as corporations, from small 10 to, fewer employees to those bigger corporations. And so going in and providing different types of training opportunities, both for management and HR. So those of you who may be in workplaces, you probably have coworkers. It starts with recognizing that abuse is permeating every single part of our lives. And it's unfortunate, and I say that like not passively, but I think, we say it's a great equalizer. It doesn't matter about your race, ethnicity, gender, income, religion, like anybody can experience abuse. And so I think creating safe workplaces and then also engaging and educating our staff and volunteers within those programs to recognize everything we do is around recognizing abuse, responding to it, and how do you make an appropriate referral. And so I think, that is one thing people can do. And if you're in a small organization or a nonprofit with a smaller budget, we will offer that free of charge to you and work to create policies that can help both you, your peers at work, and then also the people that you're helping. So I think those are things that everybody here can do.
Yeah.
And I think, as Erin, you mentioned with Alice affected people, it's, 1 in 2. With those who have gone through abuse, it's really over 1 in 3 for both men and women. So, just kind of being aware of that as well, that, even just looking around your workplace or your community or your, parish or whatever the case is, and just thinking about, wow, about a third of people in here have likely been through some type of abuse situation. So just being aware that it exists and learning more. Sorry, kind of go ahead, Erin.
No, nothing to be sorry about. That's great information. I just popped a link into the chat if you are interested in learning more about Alice or accessing Alice data for your own region. I would encourage you to look through it and utilize it in your own work and speaking engagements and grant applications. You can really look to the data to make a strong case for your services and your outreach. And then Panayota, you added a link above about the Lehigh Valley RAB. If anyone's locally based and interested in, getting engaged in a landlord collective or in the RAB's collective work, that's a great place to start.
And you had also mentioned Resilient Lehigh Valley as kind of a subset of United Way for, additional training on being trauma informed as an organization and, just learning more of those strategies as well. So I think that would be another great opportunity.
Yes, thank you. I'll pop that link in the chat as well.
Yep. Lainey said, any future opportunities to provide speakers, including survivors, into the school systems? Additionally, speaking to high school students, I think, yeah, absolutely. I think, again, specifically with abuse, because that's what we know, that's what we talk on. But I think it's over 75% of abuse scenarios occur before the age of 24, or at least have gone through abuse at some point in their life before the age of 24. So, again, I think there's absolutely that need for educating and providing awareness to the younger ages. But again, housing comes up really for everyone, whether young or old. We all kind of need one of those things, right? It's in Maslow's hierarchy, making sure that we are housed and safe and stable. So yeah, just making sure that we're all kind of aware and providing support. I'm going to open it up to questions. I didn't see any yet, but if anyone has any other questions or thoughts that they might like to offer or ask. In the meantime, I guess if you have any other resources or contact information that you might like to share with those listening, if you are joining us, I will pop our helpline number in the chat. So if you ever need us, this is our 24/7 helpline number that feel free to call at any time if you have any questions. And the helpline isn't just for, if you're going through an abusive situation. Obviously that is the primary focus, but it's really it's really that open door to services, to questions about Turning Point, really to anything. So you don't have to be going through an abusive situation to make that call. We're here to help regardless. So I don't know, Erin, does something like that exist as far as United Way if somebody wanted to speak with somebody more on some of the services or things that you offer?
Yeah, well, in terms of getting connected to services, I think you said it perfectly before. 211 is a great resource for that. So not just housing, but if you need to access food resources or childcare resources, it really is any kind of health and human services related. So you can dial 211, you can go online, you can chat, accessible multiple ways.
Okay. Thank you. Any last thoughts?
If I could just offer one up, I appreciate Erin's willingness to be here. And I just want to do a quick United Way plug again. I think we're connected with programs from all over the Commonwealth. And I think that our United Way in the Lehigh Valley is the best. I mean, and I say that because I think, you're connected in ways. So from your Resilient Lehigh Valley focus, the fact that you are the director of impact, I think you pay attention, you're active with the homeless resources. So I know everybody is frustrated by the lack of enough affordable housing, enough resources, but I also think that you take great efforts to help look into the data, to help provide it to us, and then be part of these types of conversations that I think are important to cultivate solutions. We know that there is no quick answer to any of this. I think we're all trying our best. And so I would just like to personally thank you for being here and, sort of continuing these conversations with us. I am so, for all the people that hopped in today, definitely, pay attention to our newsletters, try to find ways to get involved and help us figure out how we can sort of increase our capacity to help. But thank you, Erin. And
Yeah.
Keema, you're fabulous. Thank you so much. I love you.
Thank you. Thanks
We
for
got a
having
lot
me. I appreciate it.
Yeah,
We got a lot
thank
of
you so
hearts and
much.
thanks in the chat. And there was a comment, highly recommend Resilient Lehigh Valley Trauma Informed Training. We are going through several sessions at our agency and it is so eye-opening. Thank you, Beth, for sharing that. And then Dana as well, our healthcare response coordinator. If you have any interest in learning more about, healthcare and how we can support survivors in the healthcare field, feel free to contact Dana as well. Or, again, in general, just our training email. As mentioned in the beginning, feel free to, sorry, I clearly can't type and talk at the same time. But you'll receive an email with information on how to get a certificate of attendance with some of our contact information for future trainings, materials requests, if you would like any of our brochures or information. And a survey should pop up when you close this window. So if you wouldn't mind giving us your feedback on, really how we can best support you, because again, if we don't know there's a problem, we can't help support. But yeah, thank you guys again so much for joining us. It was a pleasure to learn more, and yeah, just thank you for your time.
And if I could just end with absolutely bring awareness to children, teenagers, those who are going to be entering into their first relationships, when they get in high school, because I was just going back to the comment about having speakers going into the high schools. I mean, it's very important that even our children know the signs of abuse, so that they hopefully can avoid those situations, but if not, at least they know what to look for. So definitely.
Thank you.
And we do have child and teen services, and they do go out to schools in the Lehigh and Northampton counties, and they do speak with the children, which is very awesome. So to make them aware as well.
Thank you.
You're welcome.
All right. I guess that's everything. Thank you all again. I hope you have a wonderful day. Stay safe. And again, we're both here if you need. All of us, I guess, not both agencies. Yeah. Have a great day, everyone. Thank you.
Have a great day. Thanks.
Thank you.
Bye.
Good morning.
Bye.
Thanks, Connie. Good job.
Thanks.